using the QR code that is put onto your door, put onto your facility's webpage, if somebody scans it in, they can do confidential reporting. And what happens is they know that the information that they're reporting on this confidential QR form is going straight to the attorney. And what you should realize is that it's creating an attorney-client privilege. And because we're a patient care organization, and because we are allowing confidential reporting, we want that information to be transmitted and analyzed in real time. And so it creates a confidential reporting system that allows privilege and gives you work product protection. This data is transmitted directly to your attorney and allows the work product doctrine for investigation to occur. It also, because we don't retain pieces of this data, we're a pass-through agency. What we've got is non-discoverable. We anonymize the information immediately as it's coming in, so we don't retain it. And that report goes straight to the attorney. The attorney is who you have the relationship with. It's your attorney. We're just merely a conduit. We're a facilitator of information, and we help you analyze that information. We work for you through your attorney. And so this allows information to be transmitted in a safe and appropriate way. And that's the whole purpose of how CareGuard was designed. We want to make it non-confrontational for the person reporting, whether that person is an employee or whether that's somebody that just happened to be going past your facility and noticed something, or whether it's a relative of the patient that's there. It allows non-confrontational reporting, and it allows it to be done in a confidential manner to keep everything safe, and it allows you to receive the information and allows you to do an investigation and fix the problem before it becomes a problem that's out of control, before the federal agencies get super involved, because it'll take them a little bit to get super involved. And it's way better for you to fix the problems right as they are occurring than to allow these things to become a pattern. And that's what we don't want. We don't want things to become a pattern. We all know that bad things happen to good agencies and good systems and good people. But when they become a pattern, that's the problem. Sometimes accidents happen, and that's why we call them accidents. But when things happen all the time and they're an issue and they're repetitive, that can produce some punitive outcome, and that's what we want to avoid. So like I said, we don't retain a copy of the incident report, which protects us and it protects you, because we can't be subpoenaed and drawn into a legal action involving the report. And the information that we gather is segregated to each individual patient, to each individual facility. Now, we do report anonymized information to the federal government through their PCO reporting program, through their compliance programs, but those are protected. And it's very interesting to me. They're protected to your benefit, because the government really wants to know if, from a surveillance standpoint, are there things going on that need to make changes at a national level, at a regional level? And they don't want to be punitive either. They want to get ahead of these situations. And if you're figuring it out for them, that really makes a huge difference. And that's what they want to see. They want to see people taking ownership and responsibility and figuring it out so that it makes a long-term difference for patients. And that's the entirety of the whole purpose of a reporting system to the federal government. And so they've made it so that these data elements can be reported anonymously, and they don't take action if they've been reported. Even though it's anonymous, they know that you're doing the best you can to make things better. So that's what we want, and that's what the patient's family wants too. Nobody wants to see any punitive action. They want to see change. They want to see improvement. And if you're showing that change, if you're showing that improvement, it makes a huge difference. If you have a nefarious family member or employee, other people are going to notice it. And so they're going to have also reported, and you can use that information in your response to figure out how to handle these situations. Because just like you have an EEOC reported issue through your QR code that may be negative, CareGuard also encourages positive information to come out. And such to the point that when we do our monthly visit, we're looking for those positive stories as well. One of the most difficult things that we find for facilities is, are they getting positive video? Are they getting positive information from their employees and from their patients that can be used to encourage other patients to come into the facility. It's really hard to get positive reviews. CareGuard allows you to do that because we're seeing these patients every month, and we build up a relationship with them, and they're willing to share. And can you imagine a collage of pictures and a collage of statements coming back with good video every month that shows what a great job your facility is doing, and these patients feel like they're being responded to, and the employees know that someone is there to help and someone is there to oversight, and it's not just directly the manager that they may not like, and that whatever they're saying is actually getting to the responsible ownership party. That makes a huge difference. And yet the ownership doesn't have to go out and do it themselves. That's one of the hardest things that you can do, because if you're an ownership group and you're going out to the facility, you'll get inundated with stuff. And we're really there to buffer you from that inundation and to get you the good data and to get you the bad data so you can respond to it, and the good data so you can trumpet it and show other people what the right things that are happening in your facility are. We focus on prevention and early intervention. And that means that we're doing a lot of screening. We're making sure that things are done the right way. We go well above and beyond the standard of care. We want to improve the patient's health and increase their health span. Now, the thing is, the healthier the patient is once they've gotten to you, the better off you are, because the less resources you have to expend to take care of them. And the other thing is, if the patient has a change in status, we want to know that, because it may change how much compensation you should be getting for that. And two, if we can figure that out, we may be able to reverse some of the disease processes. Like a lot of Alzheimer's is really type 3 diabetes. And if you can improve their cognitive health, they require less worker time. And yet they still have dementia, they still have the issues. But if you can reduce the amount of resource expenditure per patient, you can do more for the patient, and you can reduce your overall burden. You can prevent the falls from happening. Because if the patient has vestibular imbalance, which is the majority of patients over the age of 65, if they've had vestibular imbalance and they fall in your facility, you got a problem, because half of those patients go on to break something. And if they break a hip, half of them may end up dying, or they may end up permanently in another place, such as a nursing home or that's other than yours. Because a lot of times the hospitals don't return the patient to the facility that they came from if there's been something like a major fall or vestibular imbalance that was unchecked, because they think to themselves, the discharge coordinator thinks, maybe they just don't have enough people taking care of these patients. Maybe I should put them in a higher acuity situation. You can't really age in place and maintain that patient's contact if your patients are having complications that you could have prevented and they end up in the hospital, because those patients aren't going to come back to you. And so one of the things is that we want to do early intervention. We want to do preventative care. We want to do surveillance. And we want to do everything we can to improve the long-term outcome. And we want to give ownership certainty in the actions that they're taking so that they know what's actually going on. You know, if you rely purely on the one manager that is giving you data, how do you know that they're not giving you data that enhances their position and degrades everybody else's? And then later on, years later, you find out, hold on, that was a really crappy manager. So these are the things that CareGuard does. It's really a third rail. It's another way to look at these patients and to look at the care that's being delivered. And it does it in a non-punitive way. And it keeps it from becoming punitive because it creates a framework that is legally protected, so that it is legal work product. So you can help manage this before it becomes a situation. And also, when we are able to preemptively identify issues, it grows the ancillary service income for you, and it grows the opportunity for treatment. So if you find somebody with vestibular imbalance, you can do vestibular therapy. If you find somebody with upper respiratory tract illnesses, you can manage those and get ahead of it. If you find somebody with a urinary tract infection that is most likely asymptomatic, 65% of the time, you can get ahead of it. And you don't give them broad spectrum antibiotics that make things more resistant. You focus in on the specific bacterium, or if it's a fungal infection, you focus in on that and you get ahead of the situation. If you have a patient that has a wound that you don't know about because it's on their back and they haven't moved, we're in there every month. We're looking at that patient head to toe. We're looking at their feet we're looking around their entire body because we want to know how to help that patient. And we're there for you. We're trying to get those situations taken care of for our people that we work for, which is the ownership group. So essentially, CareGuard improves patient access. It improves quality of care. It reduces global healthcare costs because it prevents the things that are preventable. It prevents those things that'll end up getting the patient into the hospital. The point of CareGuard is to improve Healthspan. It does it in a way that hopefully allows deprescribing. One of the big issues that we have in nursing homes is patients are overprescribed. Whether they're overprescribed, that creates chemical or physical restraints. They may be overprescribed compared to where they were and what medications they were taking in the outpatient facility. So there's all kinds of things that we can do to improve outcome. And overprescription is one of the major things that we want to avoid. It also, because we're identifying potential issues, it allows us to have a facilitation of ancillary income. And it identifies those issues that are going to become a problem later that may not be evident up front. It also reduces the discharge rate from the facility. And the less discharge rate you have, the higher income that you can maintain. It also allows a greater attraction of the facility to potential patients and their families, because they know that it's not just the every once in a while evaluation that's occurring. It's not the once a year or every other year J-code. This is happening every month. So it's not likely that someone's going to run around for a couple of weeks and suddenly clean and make things okay. We're doing it in real time and we're producing a report. We have over a 300-point bullet point facility report that we do every time we come in, and that information is fed directly to ownership with suggestions, and it allows the ownership group to understand what's going on in their facility that they may not see. It allows them to get data feedback and goes through the legal team so that it's not something that is discoverable. And so it is something that can be taken care of before it becomes a problem.